Can pain during intercourse be a sign of cervical cancer? Pain during intercourse, also called dyspareunia, can sometimes be a sign of cervical cancer, especially in later stages. Cervical cancer develops when abnormal cells grow on the surface of the cervix, which is the lower part of the uterus. As the tumor grows, it can cause discomfort or pain during sex because it affects the cervix and nearby reproductive tissues. This pain might feel like a deep ache or pressure and can be persistent or only occur during certain movements. In addition to pain during sex, other symptoms of cervical cancer include unusual vaginal bleeding. This might happen between periods, after sexual intercourse, or after menopause. Changes in vaginal discharge are also common, which could be watery, bloody, or have a foul smell. Some women experience pelvic pain or lower back pain as the disease progresses. It's important to remember that these symptoms are not exclusive to cervical cancer and can be caused by other conditions like infections or benign cervical changes. Early-stage cervical cancer often does not cause noticeable symptoms, which is why regular screening is so important. Pap smears and HPV testing can detect abnormal cells before symptoms appear, allowing for early treatment. When symptoms like pain during intercourse do show up, they tend to be associated with more advanced disease. That's why if you notice persistent pain, bleeding, or unusual discharge, it's crucial to see a healthcare provider promptly for evaluation. It's also worth noting that pain during sex can result from many other causes, such as infections, cervical erosion, or other gynecological issues. Not every case of discomfort indicates cancer. However, because symptoms can sometimes signal serious health concerns, medical assessment is essential. Healthcare professionals can perform examinations and tests to determine the cause and recommend appropriate treatment. In summary, pain during intercourse can be a sign of cervical cancer, especially if it is persistent and accompanied by other symptoms like abnormal bleeding or discharge. But it is not a definitive sign on its own. If you experience any of these symptoms, especially if they are new or worsening, it is important to consult a healthcare professional. Regular screening and early detection are key to managing cervical health effectively. Always seek personalized advice from your doctor to address your specific situation.